Breast self-examination is just a palpation of your own breast.
Being born as a woman with two breasts, we can't avoid that.
At what age can we stop doing a mammogram?
If you don't detect the calcification, by the time you detect the lump, which already is cancerous, you're already 5 years late.
Welcome to Breast Cancer 101 series on Talk Health Asia's Health Chats. More episodes are coming up shortly. Keep tuning in by subscribing Talk Health Asia's YouTube channel.
We're here to talk about breast cancer. Dr. Teoh, the all-important question. What actually causes breast cancer?
Breast cancer is now one of the most common cancer among women in worldwide, internationally as well. And what are the causes? We do not have a specific cause for breast cancer. Example, you think about lung cancer, people are smoking, or liver cancer, people are drinking. For breast cancer, we're talking about risk factors, okay, who are at risk. So basically, we can divide it into like modifiable risk factors as well as non-modifiable risk factors. If you're a female, you're already at risk. So these are the non-modifiable risk factors. As your age increases, your chances of getting cancer is higher. And especially in Asian women, 70% of the Asian women will have very dense breasts. Dense breast means it's very firm breast. So your chances of getting cancer, detecting the cancer is actually higher, right? If you have BRCA gene or family history of breast cancer, that means there are multiple families within the first degree relatives like your sister, mother, aunt, strong family history of breast cancer, then you are at a higher risk. If there's past history of breast cancer or if there's any other precancerous condition, like if you heard DCIS, lobular carcinoma in situ, ADH, things like early puberty as well as late menopause.
Gosh, those are a lot of terms.
Yeah, exactly. So, we can't have a whole lecture here, but I think those who have gone through breast cancer, surviving, and you will tend to hear this on and off, all right? And of course, there's the other modifiable risk factors, which is like obesity, okay? Hormones, when you have high fat cells, then hormones tend to be stored within the fat. So that's why we try obesity is one of the high risk factors. Of course, other things like alcohol, smoking, radiation exposure, increase in estrogen exposure, all right? If you breastfeed more, you have more number of children, and if you have less use of OCP and HRT, then you reduces the estrogen exposure, all right? So we don't have a specific cause. This is the most common question patients will ask. But these are the risk factors. So if you're a woman, you're already at risk.
Right. Dr. Teoh, can I just ask you to elaborate what OCP is, Dr. Teoh?
OCP is oral contraceptive pills, and HRT is hormone replacement therapy. We take oral contraceptive pills not just because we don't want to be pregnant, which is what we normally know, but actually there are some other diseases like endometriosis and other gynecological diseases. We also take oral contraceptive pills. Having said that, doesn't mean that you are taking that, you definitely will have a very high risk. The risk is actually there, but it's not very high. Yeah, but it's something for you to be aware so that if you're on OCPs, then it's important that you go for your regular yearly screening, ultrasound or mammogram.
Will do. Let's get to the yearly screening a bit later. We got quite a few questions from our audience. They submitted questions, right? Quite a few people asked this question. Does soya bean actually increase our risk of breast cancer?
No, it does not. This is a myth, all right? Basically, soya is a plant protein. It's a plant phytoestrogen, all right? It is naturally occurring within the plant family. Right, but because of the name estrogen, everyone thinks, oh, it's an estrogen, that means it causes cancer. No, it does not. As with every food, we must have a balance, and you don't have to have it every day. So it doesn't mean that I refrain from taking soya or soya-based products, right? Try and take natural, fresh, organic food rather than the processed type of food.
Right. What about IVF? Does IVF actually increase your risk of breast cancer?
IVF does not increase your risk of breast cancer. No doubt they have to give certain hormones in order to boost your fertility, right? So that's like playing around with your estrogen and progesterone. So normally before they start IVF, they will have a screening mammogram and ultrasound just to make sure you're okay and it's clear. And then they'll start the treatment. And following that, usually the gynecologist will refer them to the breast surgeon, to the surgeon, and I will ask them to do a regular follow-up like every 6 months while they're on that therapy, on that treatment. So, so whether you take or don't take, also the risk, is similar to those who may not be on.
Right. Dr. Mastura, could I ask, is there a way of avoiding breast cancer?
As a woman, right, I like how Michi has actually said about all those risk factors, right? But as a woman, being born as a woman with two breasts and having aged gracefully, we can't avoid that because we do have those risk factors such as aging, being female, lifestyle factors like we have sedentary lifestyle, we take alcohol, some of us may smoke or exposed to some passive smoking, and then we probably are not as fit. We don't we are not physically active. We don't do exercise regularly. Then of course there is this estrogen factor, whether it's internally or externally, like taking contraceptive pills or even estrogen, like because we women nowadays we delay childbearing, right? So we only get married at later age, and so we get our first child at probably 30 something, and then we only have one or two children. So we don't have that. We get exposed to estrogen for a long period of time. Then there's of course genetics. So some of us may be born with unstable genes. So not just BRCA1 or BRCA2 or Part B2, but also some other genes that we still do not know that increases our risk. So avoidance may be by doing, all sorts of things that may actually reduce the risk, but we cannot omit it altogether. So what we should do as a woman today is actually to try to be aware rather than trying to avoid. You just have to be aware so that you can detect it as early as possible. You have to understand the cancer better so that you know how to tackle it together with your team of health professionals that are managing you. So I would say be breast aware together with your friends rather than trying to avoid.
I see. Wise words there. Dr. Teoh, in terms of age, right, likelihood of getting breast cancer, is age a factor? And whether as women, whether we have menopause or not, is that also a factor?
Well, as to stress again, right, cancer increases as our age increases. So is age a factor? Well, generally, cancer can occur at any age these days. 20 years ago, when I'm practicing as a breast surgeon, right, we usually see in 50 to 70 age group. All right. But nowadays, the cancer are also seen within the 20 to 40 years age group. All right. So this is the incidence of breast lumps of cancer increases as our age increases. All right. But if it's in the younger, usually the breast lumps are due to other causes of breast lumps, like fibroadenoma, or if you're in the perimenopausal age group, like between 40 to 60, then it will be the fibrocystic changes, your breast pain. So these are the common breast symptoms or lumps that you see within this age group. All right. Having said that, it can now happen at any age.
I see. If that's the case, then we talk about breast self-examination, right? What do we look for as a woman? What are we supposed to be feeling when we self-examine our breasts, Dr. Teoh?
When you are examining your breasts, all right, a lot of patients tell me, I don't know how to examine my breast. Everything feels like very lumpy and hard. Well, it's very important that is to feel your own breast tissue, all right? And when you do it, you're supposed to examine your breast, like do your own breast self-examination every month. And if you are menstruating, then it will be like 1 week or 10 days after your last menses. If you have already menopause already, then you do it every month. All right, it doesn't matter. If you want to do it every day or when you're showering or you're sleeping, is also okay. So what do you do when how do you examine your breast, right? So you use the pad of your three middle fingers, and then you press against your breast, and then you massage down into the breast until your chest wall. All right, and then you have to do it the whole quadrant from the nipple, behind the nipple area until the whole area, even up to your axilla. All right. The breast tissue actually starts from the underneath your collarbone until your lower part of your rib. Okay. And then from the middle of the sternum until the lateral part of your chest wall. Right. So sometimes they have a lump very near the bone, and I didn't know that it's actually a breast lump because the breast has sagged and then it's gone down. Right? So any part of this area that's unusual. How do you know? By doing a breast self-examination every month, you will have an idea how your breast feels like. Some people's breasts are very lumpy. Some people's breasts are very soft. So everybody's breast is different. So if you start doing every month, you will know that how it feels like. And then if something is not right, like, last month I didn't feel this lump and now I feel it, then you know that something has changed. It could be because of your menopausal, your hormonal changes as well. That's also possible. But, if you felt that every month, if it's already the next month, if it's normal, then it's okay, but if it's still there, then please go for a checkup. So usually I'll tell a patient, like, if you sleep on your pillow every night, you'll know how soft or how lumpy it is, and if your kid put a ping pong ball inside there, then you felt, there's something that's not right there, then this is how you know how to check your own breast. I hope this
Sounds
is
like
clear.
you have a naughty kid who sneaks ping pong balls into your pillow, Dr. Teoh.
Oh.
Now, what are the common symptoms that you look for, actually? I mean, nipple discharge, or what are we looking for?
Generally, what we are looking for is a lump, all right, or any changes, like it can be like your skin changes that's a bit rough, or there can be like nipple discharge, okay, or nipple that's retracted. So if you go to Know Your Lemons Foundation, it's actually an international foundation that they teach women how to examine their breast and about breast cancer awareness, right? They talk about the 12 lemons, the different signs and symptoms. So there can be like redness or any increased lump, thickening of the skin, there's retraction of the nipple, or there's skin peeling, even like dermatitis or rash. Anything that is new and unusual, please go for a checkup, all right? Now, usually breast cancer is a painless lump, all right? So a lot of time they can have a lump that's as big as orange in their breast, and they felt it, all right? But because it doesn't cause them any pain, it doesn't cause them any, they are able to go to work, eat, go and play badminton and exercise freely and everything. They are not thin, all right? And they think that, it's okay, it doesn't cause me any problem. I don't think it's a problem, all right? So usually cancer present as a painless lump, all right? And it doesn't like suddenly one day become a 2 centimeter lump. It all starts with one cell, one dot. Then it slowly will grow, right? So these are some of the different changes that you can discover.
What about tingling sensations? We had a question on that. Is that normal?
All right. So of course, one of the other symptoms of the breast is actually pain, breast pain, as well as tingling sensation. And this is actually quite normal because of hormonal changes. So our hormonal changes, because of sometimes stress or irregular hormones or abnormal hormones, right? Then it can cause our breast to feel, there will be changes within our body, and then the breast can feel swollen, can feel tender, they can feel tingling, tick, tick, tick. That sort of sensation. Yeah. Yes. So this is actually, I won't say it's normal, but if you felt that it's not something that you have felt before, then please go for a checkup. All right. Most often than not, it is normal.
I see.
That is after you have done your mammogram and ultrasound.
Now we've got one question, I believe, from MC Lim tonight, and she's asking, does having mastitis during breastfeeding translate to a higher risk of breast cancer?
No, breastfeeding, mastitis also cause a high risk of breast cancer. Okay, mastitis is very common in breastfeeding, can happen in breastfeeding. All right, so get treated is because of engorged breast and irregular pumping. That is not the risk factors for breast cancer.
We are actually doing this self-examination, right? And you mentioned breast screening. Why do we need to do breast screening if we're already self-examining our breast at home?
Breast self-examination is just a palpation of your own breast. You can't feel very, very small lumps that is less than 2 centimeter. Okay, if you're first time feeling a lump, you can detect a 2 centimeter. If you regularly breast self, you can detect up to 1 centimeter. If you do a screening mammogram, you can detect millimeters of lumps that presents as calcifications. Right? So that's why breast screening is to detect the lumps that are not felt or seen yet. Now,
with breast screening, I've heard a lot of mammogram, breast ultrasound. Is there a difference between the two?
With a mammogram, it's actually, we take an X-ray image of your whole breast, so it can be seen in one view. Or nowadays, we have a 3D mammogram. It is seen in 3D in the radiology's on the radiology screen. All right. So a mammogram will give you a quick view to look at calcifications, because breast cancer can present as little white dots or calcium deposits. We call it calcification. So you hear a lot of this. And also breast ultrasound And you also can look for lumps, okay? There is increased density on the mammogram. Then we know that there may be some lumps there. But breast ultrasound can look at the anatomy of the lumps better, or even small lumps. So you see, for mammogram, this is a mammogram, and if earlier on when I told you that most of the Asian women will have very dense breast, so when it's dense breast, during the mammogram, it will be white, okay? Whereas if it's less dense breast or more fatty breast, which you see in more Caucasian women, right, then it will be all black. If it's a cancer, the cancer will present as white. You can see in the arrow here. Yeah. So in a very dense breast, this is where, just now I told you earlier, one of the risk factors for breast cancer is dense breast, because it's 4 to 6 row. It's because we cannot detect small little cancers, which is white, against the dense breast, which is also white.
Right.
So this is where ultrasound comes in useful. The ultrasound is an image where we can delineate the lumps even better, all right? In a dense breast especially. So even up to 5 millimeters of a cancer lump, we can see in an ultrasound, right? So how do we know? Most people would like to ask. We look at the shape of the lump. If the shape of the lump is oval, like a grape or an egg, right? Then it is usually non-cancerous. Whereas if it's irregular and spiky, like a durian, and tall, then it is usually suspicious to be cancerous. All right. So that's why for our Asian women, I usually stress that they do mammogram as well as ultrasound, especially so for ultrasound if they have very dense breasts. All right. So usually in a mammogram report, they will write down that, okay, dense breast or moderately dense or very dense breast, then please ask for an ultrasound, because I think generally in Malaysia, most of the companies, they usually allow only to do one imaging, which is just mammogram. So you may have to pay for an extra ultrasound, which is helpful.
I see. So would it be an age factor, or are we looking at, I mean, if we have a dense breast, I think we just had a question come through the chat box. If we already know we have a dense breast, is there still a need to go for a mammogram?
Yes, of course. Mammogram also detect calcification that ultrasound cannot detect. Breast cancer also can present as early calcifications. All right. So these calcifications, when it starts to grow and become a lump, it may take between 3 to 5 years. So if you don't detect the calcification, and by the time you detect the lump, which already is cancerous, you're already 5 years late.
Right.
All right. So mammogram is helpful, although everyone's afraid of radiation. But having said that, if you carry a few phones and iPads around, you're already surrounded by the same amount of radiation with one click.
That is true. That's true. So age is a factor, right? What age should we start screening?
Okay, generally, our Asian population, in Malaysian population, we tend to see women presenting with breast cancer at a younger age. More than 50% of patients present less than 50 years old. All right. So that's why we bring the age group down to about 40 to 45 years. So after 40 years old, you can do a mammogram and an ultrasound if it's necessary. All right. But we do not have a very specific, like 40 or 45, so it's very individualized. So I would say above 40, it's okay to do a mammogram and ultrasound. Less than 40, if you want to go for a breast screen, then you do an ultrasound. And if it's necessary, the doctor will ask you to add on a mammogram. So it's also okay that sometimes we do the mammogram in younger age group.
I see.
When there's a necessity.
And we have another question from a lady, Mandy. She's asked, is mammogram and ultrasound the only ways that we detect breast cancer? Are there any other screening methods?
Mammogram and ultrasound is a cost-effective way of detecting breast cancer, for breast screening and for detecting breast cancer. All right. The other breast imaging tools we have is MRI breast, but that costs about more than 2,000 ringgit. And it is usually not necessary. And ultrasound is more than enough. All right. Unless you are of a high-risk group or you're already a BRCA gene patient, family history, right? Then we need to do routine MRI. Then we will advise you accordingly. Right? For the general population, a mammogram and ultrasound is more than enough.
Now, at what age can we stop doing a mammogram? Is it forever until we have some elderly ladies in the audience who are asking, at what age can we stop screening?
Well, I think previously we said 70 above, it's okay to stop. But now 70 is considered young.
70 is the new 60.
We can live until 80. People are living until 80, 90s.
Dr. Teoh, You mentioned the word fibroadenoma before. What is a fibroadenoma? It's not cancer, is it?
Fibroadenoma is just a terminology for a the commonest benign breast lump.
Okay. So can fibroadenomas and little cysts actually become cancer later? That's one of the very popularly asked questions.
Yes, usually if they be confirmed to be fibroadenoma, they do not become cancerous. Fibroadenoma is here, and the other cells, the other small little cell that is next to it, of course, that one can become cancer. That one grows, and you think that, oh, it's a fibroadenoma, then you might be mistaken. So that's why regular examination. So if you are not removing a lump,
Okay.
right, because it's not necessary. If it's a fibroadenoma, it's very small, but you still need to go for your yearly screening.
So we're going to cut the rambutan, take the seed out, look at the gene inside the seed. So by understanding that, we can plan your treatment option for your best results for that individual person.
When you found a lump, don't be scared, all right? Because 80% of all lumps are not cancerous.
So you're telling me that if there's a lump, we don't actually have to go for surgery to remove the lump?
Subscribe to Talk Health Asia's YouTube channel for more health chats episodes or find easy to understand health videos on talkhealthasia.com.